Did you know over 300 million people globally suffer from depression, making it the leading cause of disability worldwide? Of the several treatment methods that exist for MDD, otherwise known as major depressive disorder, cognitive behavioral therapy, CBT, is the most effective and the most sustainable. And I'm going to tell you why. Unfortunately, I have dealt with depression firsthand, having family and friends suffer from this disease. Today I decided to take some time and research the most effective treatment methods, and then from there decide which is the most effective out of the three popular ones. So first I'll begin by talking about SSRIs and their benefits and their drawbacks. From there I'll talk about exercise as a form of treatment, but why it's not the best form of treatment. And finally I'll discuss CBT, which is the most effective and the most sustainable treatment method for MDD. But before I begin, I feel like I'd be kind of remiss if I didn't talk about the symptoms of depression, because it's kind of silly to talk about the treatments when we're not talking about what we're treating. So I just want to go over some common side effects. So common side effects of MDD include sadness, hopelessness, anger, and irritability, sleep disturbances like insomnia and hypersomnia, and then physiological issues like random pains. So like you could just wake up with a headache one morning or have random back pain and not knowing where it came from. Those are all side effects of MDD. So now that we've covered that, let's move forward and talk about SSRIs as a form of treatment for MDD. So SSRIs, otherwise known as selective serotonin reuptake inhibitors, are a common prescription for MDD. They are common, but their effectiveness is not persistent. According to Kirsch and others, SSRIs have only small to moderate benefits over placebos, particularly in mild to moderate cases of MDD. So they're most effective in severe cases, which limits their broad applicability. So it's very odd that they are one of the most common treatment methods for MDD when they're really only used in severe cases. So I just thought that was very interesting. Like all medications, SSRIs do come with side effects, some of which include weight gain, sexual dysfunction, and some withdrawal symptoms. I know typically when we watch TV or on social media, the window for depression is going to be around 18 to 25-year-old. However, anybody can have depression at any age. But for these purposes, I'm just going to refer to people with depression as college students, because I kind of picture this being aimed towards college students. And what college student do you know who wouldn't love to have weight gain, sexual dysfunction, and withdrawal symptoms? So just the fact that they cause these long-term complications doesn't make them the best treatment method for depressed patients. So because of this, they can kind of deter their use among patients with depression, if that makes sense. So while they are a good option to have, they're not the best option because their benefits do have trade-offs. Moving along, let's now switch gears and talk about exercise. So exercise increases mood and cognitive function, but it's hard to sustain this during depressive episodes. So aerobic exercise reduces MDD symptoms through certain brain mechanisms. According to writers Cooney and others, exercise is effective in reducing MDD symptoms. So exercise releases endorphins, supporting emotional regulation and cognitive flexibility. I'm not sure if you've seen the movie Legally Blonde, but this is just where my head goes to, and it's a good way to think about how exercise affects the brain. So in the movie Legally Blonde, the main character, Elle Woods, she's a lawyer, and she's defending her client, who is a fitness guru, who's on trial for murdering her husband. And in the movie, Elle says, "Exercise releases endorphins. Endorphins make people happy. Happy people just don't kill their husbands." So that's kind of how I like to think about how exercise affects MDD. Happy people just aren't depressed. So that's kind of the mechanism behind exercise. And what makes it a good option is that you can exercise at any time. However, consistency is the issue here. So major symptom of MDD is a lack of energy, which makes this a very hard treatment method. Because I know me personally, if I'm laying in my bed and I'm not feeling well mentally, the first thing I'm gonna do is just stay there. I'm not gonna get up and be like, let's run a mile. So this is just not a very consistent method to use for MDD. In a research study done by Stubbs or others, 18% of participants dropped out of exercise programs that were meant to help MDD symptoms. So exercise as a treatment is difficult to maintain just because of the symptoms of lack of exercise, so it wouldn't really make sense to use this as a long-term solution for MDD. Which leads me into my last point, which is going to be CBT as the best form of treatment for MDD. So CBT is the most effective and sustainable treatment method for major depressive disorder. It works just as well as medications in the short term, and it could be even better at preventing relapse. So according to writers Zhao and others, CBT is equally as effective as SSRIs in preventing relapse. This is because it helps patients manage their symptoms without needing to take medication. It's great for people who can't remember to take medication or who simply just don't want those side effects that I mentioned earlier. Additionally, CBT builds self-directed reliance and it's more sustainable. So according to writers Zhang and others, CBT is effective in preventing MDD from coming back even after treatment ends. So SSRIs and exercise are used at the moment in the now. CBT is used after treatment ends, months and years after you're done with therapy. SSRIs and exercise only work while you're engaging in them. CBT works even after the fact. That is why it is the most effective and the most sustainable treatment for treating depression. So, CBT will be our most effective and sustainable treatment for depression. While medications manage symptoms and exercise has clear mental health benefits, CBT offers the strengths of the other options without the side effects, with sustained benefits, and with the skills that help people after therapy because they're getting those tools in their toolbox and they're able to use them beyond their treatment. MDD may take the hold of millions, but CBT helps them take their lives back, just one thought at a time. Thank you. I was doing so good and I forgot about my note cards again. I am so sorry. So here's number 1, number 2, number 3, let's hold it like that, number 4, and number 5. Perfect, thank you.